Hello everyone, so the next lesson that I will be showing you guys is on shaving. So, like I always do, I have my textbook right here, I have my supplies to my side, and I'm here to teach you about the lesson and to also demonstrate it. So, there's not too much to say about shaving other than the procedure itself and the different types of razors and the reason for shaving. So, the nursing assistant should always first make sure that the resident wants to be shaved. You could shave a man or a woman, doesn't really matter. But you always have to make sure that you speak with the patient first and make sure that they want to be shaved. And personal preferences must be respected. So if they prefer a female razor over a male razor, you do what you have to do to respect their personal preferences. You must wear gloves when shaving a resident due to the risk of blood. So if you were to accidentally cut the resident when you were shaving them, there's always a chance of blood. So there's always a chance that blood can be infected as well. So you want to do whatever you can to make sure that that's not getting into you. So, that's part of standard precautions as well. It helps prevent the spread of infection, which is what medicine is all about. So that's really important that you wear gloves when you're shaving. If your resident has a beard or mustache, it will need daily care. So washing and combing a beard or mustache every day is usually not enough. So the nursing assistant can ask the resident how they would like it done. She shouldn't trim or shave a beard or a mustache without the resident's permission. Don't ever just assume that they want to be shaved or they want their mustache or beard trimmed. You should always ask them first, and don't be harsh about it. Just say, I kind of noticed your hair's growing a lot. You want to talk to them about it. So there are different types of razors as well, and nursing assistants should check with their nurse to know which type of razor the resident uses or talk to the resident themselves. So there's a safety razor, which has a very sharp blade, and it helps prevent cuts, and it requires shaving cream or soap. And then an electric razor is the safest and easiest type of razor to use. Doesn't require soap or shaving cream. And a disposable razor, which we'll be using today, requires shaving cream or soap. It's discarded in a sharps container after use because obviously it's a sharp. So, the equipment that you'll need is a razor. So here I have a disposable razor with 2 blades on it. I'm sorry about that. I have a disposable razor. I have a disposable razor right here with the cap still on it. So there are 2 blades on that. And I also have a basin that is filled with water. So I have a wet washcloth. And I have a dry washcloth, and I have shaving cream in this container. I've already filmed this video before, that's why it's in this container and already used a little bit, but it's obviously clean. I just had to refilm this video. So you could also have aftershave lotion or lotion, whatever kind of lotion that they like. And gloves, of course, so always have to wear gloves. So I'm going to start now, but I just wanted to remind you guys that, of course, you have to identify yourself and identify the resident. You have to wash your hands, explain the procedure, remain face-to-face eye contact, provide privacy, and if the resident's in bed, adjust the bed and raise the head of the bed so that the resident is sitting upright. And then you want to put a dry towel over across the resident's chest or underneath their chin, or tuck it into their shirt. Or if they're in bed, it might be easier to put it on their chin than on their shirt. And then that's that. So just basic stuff that kind of go along with a lot of procedures. So I'm just going to put on my gloves, and you guys might be wondering, what will I be shaving? You'll see in a moment. It's a little difficult to show on camera because like normal, I'm usually by myself when I'm making these videos. So gotta work with what I got. So yeah. All right, so my gloves are on. That's what you want to do. You want to wash your hands, put your gloves on. And you want to soften the facial hair or the hair with warm water, a wet washcloth on the face, like hold it there, make sure it's warm, of course, and then you want to lather the face with shaving cream or soap or whatever their preference is with warm water. Warm water and lather makes the shave more comfortable. So you want to make sure when you're shaving, by the way, to hold the skin tight and shave in the direction of the hair growth. Shave beards downward. Rinse the blade off often in the basin to keep it clean and wet. When you finished, wash and rinse the resident's face with warm water, wet washcloth, and then dry it. If they are able to, let them use the washcloth by themselves. And then you want to use the towel to dry the resident's face. Offer a mirror to the resident to see if they like the results and stuff like that. And of course, when you're doing it, you want to make sure that you are talking to them and not just shaving them and trying to get the job done. You want to make sure you're still talking to them, still making it personal. You don't want to just act like you're doing this just to get the job done. You know, you want to maintain that relationship with your residents. Okay, so that's the procedure. So here I have the basin with water, and I have the disposable razor. So I'm going to take the cap off of this razor. Sometimes they're tricky. It depends on what kind of razor you have. So I'm just going to pop that off. So you are left with a razor just like this. So now I know you guys have been waiting to see what I will be shaving. And what it is, you can probably already see it. This is Jeff. Jeff is, I'm noticing right now that this might be backwards for you guys, but this is Jeff. You can see he's already got some shaving cream on his face. That's why I had to film this video again, because it's kind of hard. I only have two hands, and this is a balloon, so it's kind of hard. So I'm just going to hold Jeff kind of tight, because again, it is a balloon, but make sure when you're shaving, you're holding the skin tight. Not tight that it's hurting them, but tight enough that you have a firm grip. So this is Jeff. So the water is in here. You can actually put some more. You want to, again, make sure that it's warm. All right. Then you just want to take the razor. Again, keeping that towel close by. Here, I can put the towel right here. You want to make sure that it's not dripping wet. And then you just want to shave. So you, of course, want to go in the direction of the hair growth, like I've said before. Going in the direction of the hair growth will help ingrown hairs, prevent ingrown hairs. Ingrown hairs are painful. And for your residents, that is just creating another issue for them, creating another issue for yourself. So making sure that you take the time to properly shave them and make sure that you're doing it right and you're being super careful is really important, because you don't want them to get ingrown hairs. They're very painful, and they're a lot of work to keep up with. So yeah, so it's very important that you make sure that the face stays wet, because you don't want your razor getting stuck, and that again could cause a cut, which can cause bleeding, which can cause infection. So you just want to make sure that you are taking your time and making sure, again, that you're still talking to the resident and keeping that relationship going. So that is about all for that. So at this point, you would take your razor, plop it in the basin, set that aside. Then take the wet washcloth and wipe them off. Of course, making sure to get off all of that extra stickiness from the shaving cream, extra shaving cream. You just want to make sure that that's all off. And then making sure that you dry the face as well, which is It's very important. Then after that, you want to always give them a mirror so that way they can look at their results and everything like that. So that is pretty much all for shaving. After that, you just want to make sure you can put lotion on it if they like. You could put aftershave, whatever they use. If they don't use anything, then that's fine. Just make sure you find out beforehand what they like. That way, while the pores are still open, you can put the lotion on, or maybe not. So that is all for shaving. And then obviously after that, you would take your gloves off and get rid of your supplies and wash your hands and everything like that. But I'm just going to end it here because you already know what comes next. So thank you guys for watching, and I will see you in the next one.